Hi, my name is Amanda Saker. I'm a licensed physical therapist assistant here at our outpatient physical therapy rehabilitation for Riverside on the Eastern Shore of Virginia. Today, we're going to talk about post-stroke rehabilitation and what you may be seeing in our clinic and ways that we may help you overcome your impairments that you may be experiencing from a recent stroke or even a stroke that you've had several years ago. First, you want to know the signs of a stroke. You want to be familiar with it, and we want you to know what to do in case if you're starting to have some of the signs. First, you might notice that your balance might be off. You might notice with your eyes, your vision is blurry. You may notice that you have one side of your face drooping versus the other side, or comes droop versus the other side. You may notice that one side of your arms can lift up versus the other side being weak. You also may notice that your speech becomes slurred, having difficulty swallowing water, or you may notice that you can't get out what you want to say. You might notice some weakness in your hands. Also, you may notice some sensation problems. Your grip strength might go away. And the most important thing is you have to think about time. The quicker you are to get to help, whether it's to your calling your primary care or most importantly calling 911, time is the most important factor to prevent any further damage to the brain. The best way to remember this is be fast. B for balance, E for eyes, F for face, A for arms, S for speech, and T for time. If you remember those and you start to notice those problems, call 911. Remember, time is the most important thing. When you come into this physical therapy clinic here on the Eastern Shore, you may see us dressed in mask, as well as goggles, and we're taking your temperature, asking you questions, hand sanitizing before and out. That's because during this pandemic, our main thing is to keep all of our patients as well as our staff safe. When you have recently experienced a stroke, you might start to get concerned, and that may be one of the reasons why you're holding back coming to physical therapy. But we here at Outpatient Physical Therapy for Riverside want you to know we take all measures as possible to keep you safe. Another important thing about this clinic, which I personally love, is that we get to work one-on-one with our patients. That means here at this clinic, we do not have techs. We have physical therapy and a physical therapist assistant that will be working with you. When you come into our clinic, you will see at first our front staff. We have a nice staff that works very hard and accommodates to your needs. You'll then see on your first visit a physical therapist who will do your initial evaluation. From there, we try our best to keep you with just one physical therapist assistant and your PT that you see on your first day. That way, those two, the PT and the PTA, can work together after each session on how to improve your treatment, how to advance the patient, and if they start to notice anything that needs to be addressed. Some of our impairments that we see in this clinic are people that have fine motor skills loss as well as gross motor skills loss. What does that mean? Well, your fine motor skills have to do with your hands. We notice that a lot of our patients lose grip strength, movement in their hands, the inability to put clothes on the clothing line, which even a simple clothing pin exercise can help with that. We find some of our patients state that they notice that they can no longer put bolts that they love to work on their cars. That's okay. We provide fine motor skills with bolts. We also hear patients saying, I just want to be able to flip my hand so I can help with my frying pan or help with cooking. Well, that's why you will find some of these fine tools here in our clinic. This actually helps reverse the brain from thinking that we're moving basically what this box does is it makes you think that you're moving your uninvolved side, meaning the side that's not affected by the stroke, and you get more of a movement from your involved side, meaning the side that is damage from the stroke. Some other things that you will notice in our clinic is we try our best to get our patients back to the prior level of function of where they were before their stroke. So you'll start to notice that we will work first on getting you the appropriate assistive device that you need. Whether it's you're coming in a wheelchair and you said, look, I really want to get out of my wheelchair. I don't care if I'm using a cane. I just want to get back to walking. No problem. We will do our best to get you not only reaching that goal, but to reaching out to different companies to get you the appropriate assistive device. We will make sure that once you do receive a device, whether it's new compared to what you were once using, we make sure you use it safely, appropriately, and it's measured up to your height. Another thing that we work with is different companies to get braces for our patients, whether it's a brace for the hand to avoid the typical movement and resting place for a stroke. We look for braces to help with spasticity. We work with companies to get braces for foot drop. What does foot drop mean, you may wonder? It means when you notice that your foot is dragging along and you can't actually lift it to clear things, it's starting to catch on carpets or cords or steps. We look for braces to help clear that foot. Some of the things we do to treat stroke patients and to restore them is we access to getting different devices for their home that they may need. Whether it's, they need something to help them in their bathrooms. We might suggest to them certain different things. We try everything possible to help our patients' life outside of our clinic as comfortable and helps progress them in their therapy just as much as if they were here in our clinic. Another thing that we work on when you come into our clinic past the assistive device is fall recovery. What that may mean, when you hear the word fall, it might seem scary, but what we work on is if you did fall in your home, because once you've had a stroke, your balance is off. It's not going to be the same before a stroke. We work on how do you get off the floor safely. What do you do in case you do fall? First thing, you don't panic. Check yourself, make sure nothing is broken. Take a time, catch your breath, then look around your room. What do I have to help lift me up? What should I use, my strong side versus my weak side? These are things that we go over with you. We also work on how quick you can get from a fall recovery. That's important because it helps you get up from the floor. It helps you get out of the bed. These are things that you do on a daily life that you might not even think of. Another thing we work on is strengthening. We work on strengthening your legs. We work on strengthening your arms. When you have a stroke, it's not just one part is mainly affected. We normally see globally your entire body, whether it's only on one side or both sides become affected. So we like to work the upper extremity as well as the lower extremity, your arms, your legs. We also like to work the core. All this becomes weak. And that's what we like to do here at this clinic is we focus on strengthening. Then following that, we also focus on gait. We want you to get back to walking. If you loved to walk before, we are going to get you back to walking, or at least we'll try the best of our ability to. That's why we have these hurdlers. That's why we have these funny looking rock things. All of these tools are different tools that we have in our clinic that we can help provide you to get back to your walking. So don't be alarmed about the hurdlers. We also have ladders that we put on the floor. All of these help give you that feedback that your brain needs in order to get that clearing of that foot. But there's more. We have speech therapy here on our hands. We have a speech therapist. She is wonderful that is in this clinic. She works for outpatient physical therapy as well as our hospital. If you have a stroke and end up having to stay in our hospital setting, you may get to see her. She goes by Sarah Chu. What's great with her is if we notice that our patient's having problems swallowing, can't get the words out, having slurred speech, we actually go to her and say, do you think this patient may benefit from speech therapy? And she gives us her feedback, and then we give it to the patient and get the patient on the right track. So just remember, here at this clinic, we help our patient relearn their simple motor skills. We help our patient get back to walking, sitting, standing, lying down, changing from your different positions that you don't really think of, going from laying into bed to getting up to walking. It's extremely important to come out to our clinic after a stroke. We care for our patients as we care for those that we love. And here at this clinic, we're here Monday through Friday, 8 a.m. to 4:30 p.m. Our number is 757-302-2770. Give us a call Monday through Friday, and our great staff at the front desk will help you get your appointment in with us. Thank you for giving me your time. Thank you for listening a little bit about stroke today. And if you have any questions, please leave it down in the comment box, and we will get back to them as soon as we can. Thank you, and have a great week.